disorder. And tonight, Karyn asked me to come speak because she believes that she could lay out all of these things, but the best way to know what it's really like and understand is to hear it from somebody that is experiencing or has experienced it. So let me first start applauding you for being here tonight. You want to clap? All right. One of the most important things that I've found in my recovery is that the support of your family and loved ones is paramount. It's absolutely necessary. And I found myself very fortunate to be surrounded by a support system in my life who has stuck through it all with me. It's oftentimes a gentle hug from my mother, or the kind words of a friend, or somebody saying, just don't give up and keep going, and I'm here and I understand, that has pulled me out of the darkness when I felt like I couldn't go on any further. So let's look back. Starting off, I was always a very sensitive child. I didn't really understand that as far as I go back. Everything that I experienced was intense, not just my emotions, but literally everything that I experienced in life was very, very intense for me. And I don't know why I need to refer to those. I know me, right? Like I'm the world's best expert on me, so I'm just going to talk. Anyway, so as far back as I can remember, everything was intense, and I didn't know how to deal with it. The people around me didn't know how to deal with it. I just seemed to be over-dramatic, or looking for attention, or something to that effect. Even the slightest situation. If it were something that slightly irritated me, it was the end of the world and I became angry. If I thought that I might lose somebody or there was a threat to a relationship that I might have, it was absolutely devastating, and I would do anything that I possibly could to try to hold on to that person or that relationship so that they wouldn't leave me. And this is even if there wasn't actually anything that was happening that was threatening. But I was always afraid to be rejected and to be left behind. I want to talk to you a little bit about what it's like to have such intense emotions. Sometimes you may read, and I found this to be a really accurate description for me, that it's like being an exposed raw nerve emotionally. I'm sort of always up here, right? And so when something upsets me or doesn't upset me, even when it's in a positive emotion, it goes very high very fast because I'm already up here at this intensity level. And I want to share a story with you. Some of you may have seen this. I've told this story before. To give you an example of what that emotion intensity can be like. When I was 8 years old, my uncle brought a kitten home. And I got to play and cuddle with it all day, and I felt absolutely in love with it. I felt safe with it. It didn't judge me. It wanted my attention and love just as much as I wanted it. And my mother decided that we couldn't keep it. And the thought of having that kitten taken away after the bond that I had formed, and again, this is the intensity of it, that bond in such a short time, was so overwhelming for me to think of losing, that somewhere, as an 8-year-old, I decided that I wanted to kill myself. And I decided to do so by trying to overdose on over-the-counter medication. As I started to get sick from the medication, I became afraid. I didn't really want to die. I just had this pain and this intensity inside of me that I didn't know how to get rid of. Nobody had ever taught me how to deal with that because they didn't know themselves. But I was afraid to go ask for help and to tell my mom or to tell anybody what I had done because I thought I would get in trouble for this dramatic display of emotion. So I kept it to myself, and I didn't tell anybody for years. So that's just an example. Part of the story that comes with it is that for the past few years before this had occurred, I had been suffering from abuse. This wasn't something that my mother was fully aware of. This was something that was largely kept hidden from my family. And um, I don't think I knew how to speak out about that. So being emotionally sensitive, having that intensity and going through that, I'm sure you can imagine, does quite a number on a child, especially when they don't know how to reach out. I hung out with my older brother and his friends who were sort of the rebellious bad kids who experimented with a lot of drinking and drugs. And at 8 years old, and between the ages of 8 and 10 years old, I started to hang out with them and experiment with those things myself. And I'd finally found a way to sort of ease the pain that I was feeling, that was building up inside me, because I didn't know what else to do except try to keep it in, because when it came out, I got in trouble, right? Or sort of dismissed in a way, you know, if I were upset about something, or I said I don't feel good, and the response I often got was, "Oh, you're fine," or "Oh, you're just whatever." But it didn't feel that way to me, so I learned to keep that stuff inside. And so experimenting with drugs and alcohol helped me find a way to sort of numb that. And so as often as I could, I tried to stay in that numbness. I didn't want to feel it. And so for the next few years after that, the abuse continued, coming from several different directions. And when it finally stopped, I was 12 years old. And I don't know how far back it went, to be honest with you. I could go into that, but I think that's another story for a different day. When it stopped, everything came up, and I started to become unraveled. I, one night, decided to take a razor blade and tried to cut on my wrist, but it hurt too bad, so I stopped. And I went to school the next day, and I told my best friend that I wanted to kill myself. Again, I don't think I really understood why or what that meant. I just didn't want to have to struggle or suffer, and I didn't know what to do with it. She was understandably terrified, so she ran to the counselor's office and told the counselor what I had told her. And I was quickly pulled in, and my mother was called on the phone. When she answered, she seemed very angry. And I was terrified, and she said that we would, talk about it later when we were both home. She didn't know what to do, and I can't really blame her. Part of what happened was she drove me to a psychiatric hospital and told me that if I didn't come clean about everything that was going on and why I wanted to kill myself, that she would put me in that hospital. And so I came clean about everything because, one, I didn't want to be abandoned. I didn't want to be left there, and I wanted help. So I told her about all of the abuse and everything that had been going on, about the suicide attempt at 8 years old. And she and I decided together that I would go to a day hospital for children in downtown Houston. I started going there, and it consisted of pretty much class. You had like class where you had to learn, and you had group therapy and sort of recreation time. And inside of that classroom was what they called a timeout room. And it was really just a small room with white padded walls. And so one day I'm there, and we're in the recreation room, and one of the techs that was there in charge of watching us at the time was getting on to one of the other patients. And I decided I wanted to be big and bad and fit in because, truth be told, I didn't know who I was. I didn't know where I fit in, and so I was always trying to kind of see what role I could play to be accepted by people. So I decided that I would tell him to shut up in a not so nice way. And his response was to tell me to get up from my chair, and I didn't. I refused, so he came up behind me, and he sort of pulled me up out of my chair and dragged me out of the room and down the hallway. And the whole time I'm trying to kick him, and I'm screaming all sorts of four-letter words, I'm sure you can imagine. And my mother happens to be in the library off of the hallway in a parents' meeting. And she becomes humiliated because I'm screaming so loud that the other parents in there, whose children are also there because they're having difficulty, are saying, "Whose child is that?" And it was me. So that's just sort of an example of that intensity. Unfortunately, the way that insurance works, oftentimes, and some of you may be familiar with this, is after 30 days, if you're not actively suicidal or homicidal, they won't cover you anymore. And they sort of just let you go out into the world to figure it out for yourself. So that's what happened. I went back to school. I started going to a adolescent and teenage recovery/support group that my older brother had been going to. And it was the coolest thing, because for the first time in my life, there were all these people, and they liked me, right? And everybody was family, and everybody wanted to hang out all the time, and there was always something to do, and there were people calling you all the time and inviting you to go places. And I thought, wow, this is great. You know, these people don't want to reject me. I can tell them exactly who I am, and they love me even more for it, right? But like most relationships that I've experienced in my life, that went sour. And at some point, my sponsor, it was a 12-step program, told me that I shouldn't speak in meetings anymore, which was a really hard thing to hear because it was my sponsor, and she had just silenced me. So I felt rejected again. And I eventually, went back to hanging out with bad kids from school and getting back into drugs and drinking. At 13 years old, I asked to be put back into a hospital. Just spinning out of control, in pain, miserable. And so I went to an inpatient hospital. This hospital was affiliated with a support group, so I had gone back through them. And I had seen other people that had come in and out of that and had really good experiences with it, and had, established these bonds with other people. And that was something that I really wanted for myself. So I went and tried to, again, find a way to fit in with people there. And the only way I knew how to do that was to kind of listen to what they said and then try to mimic it, right? By saying things that they liked or they believed in. But the thing is that they got to talking, and it turned out that some of those things were contradicting the other. And so one night, after hours with no counselor present, they all pulled me aside and confronted me as a group. And I don't know if that's ever happened to any of y'all, but that's a horrible feeling. Absolutely horrible feeling. So again, I felt rejected in a place where I'd gone to get better. And again, 30 days came up, insurance released me, went back out into the world, went back to drugs and drinking. At 14 years old, I started cutting on myself. And it's sort of strange because I don't really know how I knew about that. I think I was actually sort of a little punk rock girl at that time, and I think there was somebody I idolized that had done that, which seemed super healthy. So I started doing that to sort of release the pain, because, the thing is I have a huge heart, and I didn't want to hurt anybody else. And I didn't know how to get it out. But I could hurt myself and release a little bit of that. So that's what I did. And I kept it hidden through my clothing. I stopped going to school as much. And I remember at one point, my mother would beg me to not hang out with my friends anymore and to sort of straighten out, and even went so far as to say, I can't stop you from hanging out with them, but if you do, I'm not helping you. I'm not going to give you rides. I'm not going to come get you. You're on your own with that, thinking that would stop me. So one day I went over after school to hang out with some friends, and about 10 o'clock at night, I called my mom for a ride home. And she said, no, walk home. And well, this is Southwest Houston, 10 o'clock at night. And I certainly, as a 14-year-old girl, was not going to walk home. A 14-year-old anything, boy, girl, whatever, wasn't going to walk home. So she said, don't come home. So I didn't for 2 weeks. Unfortunately for her, when I came home, I had dyed my hair black, shaved it into a mohawk, and gotten 2 tattoos. She was not very pleased. 2 days later, at the advice of some of the group counselors, she kicked me back out. And I had no choice but to go back to the group and sort of rotate around at different people's houses whose parents would let me sleep on their couch or had an extra room. And that lasted for 2 months. And then something sort of changed within me to where I don't know. I started working the steps, I started doing these things, and started meeting this kind of ideal. They asked me to be on their steering committee. I started sponsoring people, um, and everything seemed to be getting better, at least I thought. You know, I stayed there for a while, and that went bad again. I needed a way. I didn't agree with what was going on there. I wasn't fitting in with people. I tried to move on to a different group. That didn't work out. So over the next few years, I went back out and started doing drugs and drinking again and making all kinds of bad decisions. And got into some really hardcore stuff. And that lasted till I was 20. And something happened that sort of changed my life. Sometimes I refer to it as my own personal 9/11, you know, that moment that sort of changed everything. And a very dear friend of mine who was a core part of my support, who loved and accepted me, no matter what, even if he saw me freak out, even if he saw me have an outburst, he struggled with his own battle, and he gave in, and he killed himself. And it shook me out of probably the darkest period of my life. It sort of shook me awake. Strangely enough, I met somebody at the wake, which is, you know, romantically met someone, which is certainly not, you know, a place that I go to look for meeting people to date. But I did, and we clung to each other. We were both lonely, lost souls that didn't want to be alone, and finally we had somebody to sort of hold on to. Some friends of his asked us if we wanted to move away to this new town, and I had even stopped going out anymore because, you know, I was getting blackout drunk. I was doing all these things, humiliating myself in public, and I just didn't want to be around anybody anymore because I was so embarrassed. Like, I had to be intoxicated to be in public to even deal with it, you know. So we moved 5 hours away because I thought that if I got a new start somewhere else, maybe it would be different. But the thing is that I was still me. I was still an emotionally sensitive person. I was still recovering from going through abuse that I didn't know how to deal with, and all the emotions that were inside me having to do with that. You know, I'd gone in and out of therapy. I'd gone back at 16 after another suicide attempt and a falling out with my father, and tried to go there. Couldn't keep up my appointments. As you'll hear and have probably read, is very typical of borderlines. I just couldn't do it. I couldn't deal with the emotions that would come up. It was like this water balloon that if I tapped on it just a little bit, it would just burst, and I couldn't handle that. So I moved away. Again, thought maybe things would get a little bit better, but they didn't. You know, same story. I met people in my life, and this has happened over and over and over again, and they liked me. I can be pretty charismatic at first. I can be funny and sort of theatrical and, you know, dramatic in a good way, right? And all of those things, and people really adore me until they see me have an outburst or something to that effect. And then they start to kind of do this, you know, like, I'll just kind of like you from over here, you know. Then, you know, the invitations to go to parties or different events start to decline. People start to kind of whisper, give me that look whenever I enter a place. And so I want to withdraw again, right? Because I don't know how to do this. I don't know how to deal with rejection, you know. The thing about having borderline personality disorder is that all you really want in life is one, to know who you are, because you don't. You don't know who you are. Or I didn't know who I was. And you want to be loved and accepted. But the thing is that you have this intense emotion, and people don't know how to deal with it, and it causes you to be rejected, right? So the very thing that you struggle with is the very thing that keeps hurting you by pushing people away that don't know how to deal with it. And you don't know how to deal with it. And nobody ever taught you because nobody knew. So, you know, I became at work this sort of tyrant that, When I came in, I was a manager at this shop for a long time, and my employees would sort of, you could see them tense up, very apprehensively, try to see what my mood was that day. Should they wait? Should they back away? Should they just quietly keep busy? And I didn't like that. I didn't want to be viewed as this monster. Again, I had this huge heart. Like, I loved people. I loved the world. I loved animals. I didn't understand. I didn't understand why I felt this way, why I couldn't get past things, why nobody else around me understood, and why it was different, because I would see other people get angry or upset, right, and react to things. Why was it different when I did it and they didn't? And I don't know, I felt so alone. The relationship that I had been in eventually ended, and I jumped right into another one, and this was a pattern for me because I just would do anything to not have to be alone. So just one right after another, one right after another. A few years later, I'd gone back to college after a horrible family tragedy. Pushed me sort of, like you don't know when life is done and you have to jump on any opportunity you can. So I'd gone back to school, somehow got through that. I don't even know. I got a bachelor's degree in 3 years. It was very intense. When I got out, my grandmother was sick and here receiving treatment for cancer, and I didn't want to miss out. So I moved back home. I was never going to move back to Houston, right? I didn't want to ever be seen by anybody but my family sneaking into town for holidays. So I came back, and I was super lonely. I lived, at 30 years old in a garage apartment behind my parents' house, where I was going to live while I went to school for my master's degree. And I would cry to them on the weekends because I was just so lonely. But one of the benefits to being an emotionally sensitive person is that I'm extremely passionate about things. I have a huge heart. I care very intensely and deeply about things, and I'm very passionate about that. And that allows me to be an activist and allows me to speak out. And coming into Houston and being that lonely, I decided that I would figure out where the people that were like-minded hung out and the things that they did, and I would go do those things, and I would go to those places, and I started meeting people. But it was all at a very, surface level, and like a professional activist networking thing. So they didn't really know me, And I was at where I met somebody involved with an organization, which I would later move into and become a part of, that were totally aligned with what I believed in. And that went really great for a while, and like everything else, crumbled. I had a relationship with somebody that was involved in the organization, and I had, that's funny, I had decided, I didn't think I could have a good relationship, right? It was too crazy, I was too broken, I was too damaged for anybody to want to stick around with me. It wasn't worth it, it was too much. But I found this person that I thought was the ideal that I was looking for. They were ambitious, they were an activist, they were self-sufficient and reliant and all of these things that I thought would be perfect for me. A friend of mine laughs at me later and says, I think you overshot that a little bit because the heart wasn't there and the things that really mattered. I got told for, a year and a half in that relationship that I was too intense, too overdramatic, too much to deal with. Even as I would beg and cry and plead every time they threatened to leave me, I even got told once, in response to me saying, I know I have issues, but I'm really trying to work on it. They said, all right, well, give me a call when you do. Just lost. Stayed in this organization, would go in and out of depression, after I was rejected or dumped, I would go into these wild periods and just make a ton of bad decisions and just hurt myself more. I chain smoked, which I think for me was a way, to try to commit passive suicide. I wanted to go. And I think I was too afraid to kill myself, even though I had tried multiple times, but I wanted to go. And so I just kept throwing things at myself to hurt myself and to just stay in sort of this numbness. I'm not even really sure how I continue to function in the outside world in this professional level, except that, again, I didn't know who I was, and I became a really good actress. I'd been in theater in school, and um, I've been doing kind of public speaking things most of my life, and so I was really good at kind of keeping those things up. I met somebody else who I thought could finally handle me. They even had a psychology degree and understood some things, and said that they were pretty sure that they knew how to handle me. And about a month into that relationship, they told me that they loved me, and then, what do I do? Now this person loves me, and I have this good thing in my life, and oh God, if I have this good thing, that means that it can unfold and crumble, and I'll lose it. So now I'm going to freak out, and I became hypervigilant. Like, they came to my house every day. We hung out every single day, and I would come home knowing they were there, and I had a lot of roommates. I lived with a lot of people, and as I was walking in the door, my head's going, all right, what situation am I going to walk in and see them in that I'm going to get upset about? And I started just sort of unfolding, and it started affecting our relationship, and I had to do something. So I found these support group meetings that I went to for other adult women who had been through some of the childhood trauma that I'd gone through. But the thing was, we started talking about the trauma again, right? And all these things started coming up, and I didn't know how to handle it. I needed something else. I started having emotional outbursts every day. I'm pushing my partner away. I'm pushing my roommates away. My family doesn't know what to make of it. I think even during an argument with my mom, I was so angry. It sounds funny now that I took a banana and broke it on the counter while arguing with her. Like, just in this place, totally lost. And I needed help. I was researching on the internet, and for the second time, this had happened like a year and a half, 2 years before, I kept coming across PTSD. Which I think, like most people, probably always associate in your mind with veterans and things like that. So I decided I would seek out a trauma specialist. And by that I mean people who specialize in dealing with women specifically who have been through the kind of traumas that I had been. I thought if I could get properly diagnosed, if I could put a name on it, then I could figure out how to fix it. So I went and did that, and she agreed with my self-diagnosis for PTSD. She also diagnosed me with major depression, not the first time I'd been diagnosed with that, and not a surprise at all. But then she said something that totally blew me away, and she told me that I had borderline personality traits, which, people laugh when I say this, but she didn't call it borderline personality disorder until later on, because apparently it's a very serious diagnosis, right? Very scary. And so you can't say that right off in the first session. And I thought, well, this is nuts. I had been seeing the same therapist for 3.5 years. I went and told her, and she said, oh, I think that's just, too much, too fast. And I started looking in it, and the DSM, and I started looking at that. There's 9 criteria, and you only had to have 5. And I had all 9, and not even just kind of, and it made sense. But the thing that happened was I started looking at all the things I identified myself as, and I started realizing that they were symptoms, either of the PTSD or the borderline personality disorder. And so somebody who already didn't know who they were, the only thing that they did identify as started to crumble before me. And then I started identifying myself as somebody with borderline personality disorder, which isn't really who I am either. And it isn't who I have to permanently be either, right? So I freaked out for a while. That doctor had recommended that I try DBT, dialectical behavior therapy. She told me a little bit about it. I traveled overseas for a month and a half and wanted to start when I got back. I got back, and a month after I got back, traveling with my partner, they dumped me because they couldn't handle it anymore. And we just had this intensive, month and a half, really intense trip together across the world. And I again had fallen in love. Again, I had my heart just sort of stomped on the floor. And I went into a very, very dark place, and I started thinking about suicide every day. if I was outside smoking a cigarette, I was looking at my surroundings, thinking, what am I looking at right now that I could use? How could I do it? I was researching online, like, if I did it this way, what are the chances I could fail, and what would the consequences be? And what if I did these combination of things? And like really just focused on it, started planning in my head. I tried. I reached out to the DBT Center with the last little bit of hope that I had in me, and scheduled an intake evaluation appointment and went to that. That was on a Wednesday. By the time that I had gotten to that appointment, I had decided that on Thursday night, the next day, I was going to check out. I was going to be done. And this is where my mind was. To give you an idea, the next day was that person who had just broken my heart's birthday. And I wanted them to know how bad they'd hurt me. And that's a pretty dark thing. I wanted to do it. I was done. I couldn't do it anymore. I couldn't stand the pain anymore. I didn't want to fall in love again. I didn't want to have my heart broken again. I didn't want to be rejected and outcasted from people. I didn't want to hear people say things about me like they had, like everywhere she goes, drama follows her. She's a hot mess, all of these things. Even forgetting all of the wonderful, lovely, nice things that I had done for them as well. That didn't matter, right? Because the outburst kind of overshadowed everything else. I went to my intake evaluation and was just numb, just dead. And my therapist who was there could see this in my posture, could see it in my face, could hear it in my voice, and brought it up to me, asked me if I'd been thinking about it. And I said, yeah. She said, well, how? And I kind of lied to her. And I kind of downplayed it, that I wasn't really that far, But I knew. I knew I was going to go home. I knew the next night I was going to do it. So I went home from the appointment, and I went into my room, my sanctuary, and got out my laptop to zone out on Netflix, right? Because I didn't have to think about anything if I was looking at that. And in that moment, my computer decided to do, like 30 updates or whatever it does. And so I'm left there laying on my bed to think. And I start thinking about this person that I love, that broke my heart, and the intense amount of lifelong pain that it would cause them if I went through with this. Which again is, like I'm not really even thinking about me at that point yet. It's everybody else, because I don't know how to take care of me. But then I did. Then I started thinking about, I'm 34 at this time. There were things that I always wanted to do that I hadn't had a chance to do, like have children, because I hadn't been able to be in a stable enough relationship for long enough for that to even be a possibility. I wanted to travel the world. I wanted to fight the good fight. I wanted to help make the world a better place in whatever capacity I could possibly do that. And I thought, well, this decision is pretty final. And was I really ready to completely give up on all of that? Things started turning. And I thought, what if there's a possibility that DBT works for me? What if it actually works? What if it actually works and I get to do some of these things or different things, whatever I decided I wanted to do? So I made a decision that I would try DBT. And I always had the fail-safe, I could always go back to my original plan if that didn't work, like everything else that had never worked. 23 years of therapy that didn't work except for give me a lot of self-awareness, more than most people I've ever come across. But didn't have the skills. So I went into DBT. I've been in it for a little over a year and a half now, or almost a year and a half now, I guess. And it has finally given me something that I always wanted that none of that therapy gave me, and that was the answer to, what do I do? How do I communicate? How do I deal with my emotions? How do I navigate around this? What do I do? I need something. And so I started learning that, right? And it's not a perfect practice, right? I mean, the thing to remember for me that I've really had to have compassion and patience and understanding with myself about is that I'm an emotionally sensitive person. right? I'm this emotional raw nerve walking around. That doesn't go away. The BPD, I can treat that, right? I can get past that. But I'll always be emotionally sensitive, and that's okay. Because even though I can feel anger and jealousy and sadness and anxiety and all of these things super intense, I can also be giddy and happy and joyful and full of love and creativity and excitement. So I don't know, that's sort of a gift too. And it also fuels that fire inside me to be an activist and to do things like come and speak to people. I found a bit more peace. I've started to know myself more, and if there's any way that I can share that with other people and let them know that they're not alone, or to let their loved ones know that there is hope and not to give up, and that it's your love and light that can help pull your loved one through, I would have been absolutely lost if the people in my life had totally given up on me. And they had plenty of reasons to, plenty of times, but they didn't. Lots of people left, but just enough people stayed. And most importantly, my mother. Because if I go back to that dark place, I'm not going to lie, sometimes it happens. I'm not about to do it, but I'm not going to say it never crosses my mind. I think about her, and I think about how much she stood by me, and how much I love her, and how much I want to stay in the fight for her. So if there's anything I can get to y'all today is to beg and plead. I'll do that. I'm humble enough. Don't give up. Please. I know that you must see that there is a beautiful, passionate person inside of your loved one. Hold on to that, because that's who they are. That's who they really are. They're not all of this pain that you see in these outbursts or these emotions or this darkness. They're that beautiful person that you know they are inside, that you love. They're absolutely that person, and they just need some time and some love and some compassion and understanding. And I would also ask that you give that to yourself, because this is a journey for you all too. And I'm probably left out a lot of stuff in my notes, but I feel good about it, and I just want to say thank you for coming tonight. Thank you for being here. Thank you for not only taking an active role and trying to help your loved ones, but also yourselves, and keep hope, because it can get better. Thank you.
So at the bottom of BP, now I'm coming from a very specific theoretical orientation, and that is dialectical behavior therapy. If you talk with someone from a different orientation, they're going to perhaps have a different view. So I just want to be sure I say that. So in DBT, what we see borderline personality disorder as a disorder of emotion. That it is the inability to manage emotion that is creating the symptoms and all the pain that Jaime went through. It is like walking, that Marcia Linehan, who developed DBT, says it's like walking around like a third-degree burn victim all the time, that you don't have a shield. And everything that you run in, every emotion is so painful and more intense. You see, what are we talking about emotion regulation? You see, you and I, people who do not suffer from borderline personality disorder, emotions are like a bell curve. They come, they build, they reach a peak, and then they go back down. And that's not the case for someone with borderline personality disorder. For someone who has borderline personality disorder, the emotion shoots up quickly, very reactive, very fast. It stays at a peak longer, and it very, very slowly comes back down. So very quickly, like Jaime talked about, young children start to realize that they're different, that they don't feel things the same way other people do. You, as a parent, don't really know what's going on. You know, one child is still crying about a sad movie 30 minutes later when the other children are all out playing and have forgotten about it. And you say something like, get over it. Go on and play. And then you're doing the best parenting. You're trying to help your child get on with it. But that child, because you don't know they're different, that child then says to themselves, there's something wrong with the way I feel. There's something wrong with the way that I experience the world. There's something wrong with me. So emotion regulation, what that is our ability to control and choose the emotions we experience, the intensity of it, and how we express them. What you're doing naturally is you are looking at situations that get you upset, choosing to go into certain situations and not go into others, and that is one way that you regulate your emotions. Another way is that you look at what you pay attention to. And you can pay attention to, if you're in a situation that's really tough, you can remember in your head that other parts of your life are really good and that this is just a moment in time. So one of the ways that you regulate your emotions without even thinking about it is by being able to keep the big picture in mind. You can also look at the cognitions and what you're telling yourself. When you're telling yourself, I can't stand it, you say, wait a minute, okay, look, I can get through this. I don't want to, I don't like it, but I can get through it. And then you can choose your response. Like if you're really upset with your boss, you don't fire off an email telling him he's the worst jerk in the world and just take his job and you're leaving. You don't do that. You can choose your way of responding and choose how to act on the emotions that you have. That's emotion regulation, being able to experience the emotions, but not have the emotions control you. But emotion dysregulation is when you can't do that. When your emotions are so strong that they control you, that then you are telling the boss off. You are telling your best friend that she's the worst person in the world. You are sending 56 text messages to your ex and throwing their clothes out on the lawn. You are just acting, your emotions are in control of you. And in addition to that happening, you see it later. If you've ever been in a situation where you really couldn't manage your emotions, if you've ever been really, really threatened like that, it's like that most of the time for someone with borderline personality disorder. So what happens is we have different nervous systems. I'm not going to go into that too much right now because I want to get to the communication part if I can. But we have the parasympathetic and the sympathetic nervous system. And what happens is when our threat response kicks in, then the frontal lobe of the brain, which is the part of the brain that thinks and plans and analyzes things, when we're in a threat mode, that part of the brain is offline. That's our survival system. It's like when you're a caveman and there's a saber-toothed tiger coming after you. You don't want to start and think, I wonder if that's a male or female saber-toothed tiger. I wonder if he's eaten. I wonder if I turn to the right or the left, which would be better. That's not effective. So our system is that when we're threatened, that goes offline and we react automatically to save ourselves. Either fight, flight, or just sort of be paralyzed. And that's effective. That works. But what if there's no threat? And you can't think because the frontal lobe is not online and emotions are in control and just causing you to react. That's what's happening with people with borderline personality disorder. Their emotions go up higher. They're in overactivation. They're in overwhelm. They can't think. And then what happens sometimes is they'll do something because they know. In fact, they fear that their emotion is going to last a very long time. In fact, sometimes they fear that they will never get out of it. If they go into sadness or depression, that they'll never get out of it. So what happens is sometimes they do things to get that emotion down. And that's like putting on an emergency brake. Jaime talked about some of the things she did. She cut. And a lot of times that's why people with BPD cut. It's to get rid of that intensity of emotion because they don't know any other way. They drink. They gamble. They shop too much. They do all kinds of addictive kinds of behaviors, something to numb themselves so that they're not feeling. And that's a way that they have of stopping the emotion. If they don't, the feeling just keeps going and staying up at that peak. And in fact, the brains can sometimes ruminate and just sort of keep bringing up the story over and over and over again. That person hates me. They rejected me. Did you see how they treated me? And it just keeps the emotion going. And so they stay in that kind of pain. So it kind of makes sense. You know, if you had a choice between being in constant emotional pain or doing something to shut it off, and you have no idea what to do that works in a healthy way to shut it off, you would do what it took sometimes to just stop the pain and to try to be like the way you see other people being. Because you can see another part of the pain is being able to see that you're different. And you see that your emotions are causing issues for you. So the point I want to make is that emotion dysregulation is not the same as just being upset. Emotion dysregulation, and sometimes we call BPD emotion dysregulation disorder. Emotion dysregulation is when you can't think and when your emotions control you and you can't be effective. So what's the person going to focus on? They're going to focus on getting rid of that pain, getting that aversive stimulus down. They're going to focus on that. And it's going to happen most often in their most important relationships. Relationships with family members, spouses, and friends. Because those are the most intense relationships. Their behavior is going to be reactive and impulsive because they're driven, and sometimes they get to the point they're afraid of their emotions, and you start to feel an emotion and they've got to do something to shut it down right away. And they're either going to attack or withdraw. That's the fight or flight, right? So they're going to attack in anger, and that's the way they're going to defend themselves. That's the way they're going to, and sometimes it's a way of trying to release those intense emotions, or they're going to withdraw. That withdrawal can be pretty cold. It can be a barbed wire fence. And I would like for you to remember right here at this point, I'd like for you to remember how Jaime talked about how alone she felt. So on the other side of it, you're looking at how someone's pushing you away. They're angry at you all the time. You can't do anything right. You're awful, though they hate you. Or they're pulling away. Don't want to talk to you. Don't want to be around you. A barbed wire fence. And yet on the inside, what's really going on for most people with BPD is this intense loneliness, an intense wish to fit in, and an intense wish to be cared about and loved. So here it is. There's the core, the emotion dysregulation. And this is from Alan Verzetti, by the way. And on the outside are the things that come about as a result of the emotion dysregulation. So these are interactive. So what happens is, let's go with self-judgment. So someone who has emotion dysregulation and they quit their job impulsively and tell off their boss, and they're not going to get a reference, and they've calmed down. It's 2 days later, they're calmer. They judge themselves. And so the more they judge themselves, the more dysregulated they get, the more the level of dysregulation rises, and it's just going to make things worse the next time. Because people with a BPD sort of walk around with a higher level of arousal than other people do, and the more they judge themselves, the higher that level of arousal gets, and the more reactive they're going to be. And so then that leads to more emotion dysregulation. That's going to lead to more behaviors that are going to lead to self-judgment. That's going to lead to more. It's just a cycle. So you can see how that works. And it works with all of these on the outside. If you have emotion dysregulation and you're so terrified that people are going to leave you, and you're so scared of being abandoned, and you don't want to be alone, and you're seeing that there's something different about you. I did interviews with over people. I don't want to exaggerate. How many was it? 60? 60. I did interviews with 60 people because we're doing a study with U of H. And so I did interviews with 60 people and talked to them on the phone about what it was like for them to grow up emotionally sensitive. Every single person told me, I just didn't fit in from the very beginning. I didn't have a place I belonged. So you have the fears of abandonment. You've got the emotion dysregulation. And then because they feel like they don't fit in, they start to get really scared of being abandoned. We all want a tribe. We all want to belong. We all want to have a place we fit. And so they're scared of that. The more scared they get, the more dysregulated they get. And then the more they're going to be angry and push you away and get scared and act out of fear and not be able to think. And then the more fear of abandonment they're going to have. So it becomes such a vicious cycle that they don't know how to get out of and they don't see an end to. So one of the things that makes everything worse is something called invalidation. And invalidation and validation are near and dear to my heart. But you can have an emotionally sensitive person. I'm an emotionally sensitive person. And I think probably most therapists are emotionally sensitive person. Artists are emotionally sensitive people. I think most ministers are. Most people who work with other people in some sort of service way are emotionally sensitive people. So what's the difference between someone who has BPD and is an emotionally sensitive person and someone who does not develop BPD? Well, we have a theory about that there is some research evidence to support. And the idea is that some people are born with more intense emotions. They're born, that's the biology part. They're born with, they react more quickly, their emotions stay higher longer, and it's slower to return to baseline. That's biology. But there's an environmental part to it. And that environmental part is what we can change with education. It's also the thing that if you're a parent or a family member, it's the thing that you can do differently. It's one of the ways that you can help your loved one. And that part is validation or invalidation. So when someone's born with emotional sensitivity and they are a young child and they go to the movie, and we'll talk about, we'll use that same example. They go to the movie and they come out and they saw Bambi and they come out of the movie and they're still crying 3 hours later. You've got 2 other children. You've got a job to go to, and the other 2 kids are fine, and the one child is still crying. What's the normal thing to do? What's the thing that every parent's probably going to do? You guys stop talking to me? Are you withdrawing? What are you going to do? Get over it. Come on. It's time. Too much. Too much. Come on. Let's get some dinner. We got to get you ready for bed. Got school tomorrow. And I want you to hear that it is not your fault. But what you're doing is you're invalidating. That is when this child on the inside says there's something wrong with me. Why can I not get over it? But you don't know that. What you're seeing as a parent is a child acting in a way that isn't like other kids. And in fact, it's probably going to get them in a lot of trouble if they keep it up when they go to school. Because it's out of the ordinary. And it sure does seem like they're making a big deal because nobody else is reacting that way. And you hadn't been here to hear this talk. So it's what we all say and do. When someone expresses themselves in that extreme way and it's out of the ordinary, we're going to say something like, come on, tone it down a little bit. Get over it. It wasn't that bad. Come on, sweetie, it wasn't that bad. But yet, what we're doing is we're teaching someone and we're telling someone when it occurs over and over and over, pervasive. I mean, we're all going to be invalidated over and over in life, but when it's chronic and pervasive about emotions, then what happens is that person starts to learn not to be able to trust their internal experience. And that's part of that identity thing that Jaime talked about. I don't know who I am. And I'm looking to other people to see how I should behave and what I should like. And I'm looking for other people to tell me what's the right way to respond. But then I can't keep it up. And then I've got 2 people doing 2 different things. And then they're telling me I'm a fake. So the invalidation of their experience is the part that we think chronic invalidation leads to borderline personality disorder. So this is what happens really quickly. An event happens. There's a heightened emotional response. There's this vulnerability that they have. And by the way, for everyone, if you don't have sleep, you don't have enough food, you don't have enough rest, that makes you more vulnerable. The same is true for someone with borderline personality disorder. They're going to be even more vulnerable. And the biology that they have, that whatever degree, you could be born with different degrees of emotional sensitivity, whatever degree that they have, that's part of their vulnerability. And then the judgments come in, And the judgments make everything worse. I'm a bad person for the way that I'm responding. I'm a bad person. I'm out of control. I'm crazy. There's something wrong with me. I'm broken because I'm having this emotional reaction that no one else is having. And then that leads to all of these dysregulated behaviors. They're trying to take care of those emotions, and they're trying to get rid of those emotions, but it comes out in these ways that just make things worse. And what that is an inaccurate expression. Okay, so let's talk about inaccurate expression. Are you guys still with me? Am I being... Okay. Okay. So inaccurate expression. You, parent, are at home. It is, let's say, 2 a.m. Your daughter is not home yet. It's raining. You know, it's one of those downpours in Houston, just pouring down outside. What emotion are you experiencing? Fear, terrified. You haven't heard from her, terrified. Okay, she walks in the door. She's okay. She walks in the door. What's your reaction? Fury. How dare you? You are so inconsiderate. Do you ever think about anybody other than yourself? It's natural, it's normal, and it's inaccurate. Because what you're really feeling is fear. But you replaced it with anger. Now let me ask you, see, in DBT we're all about what's effective. So let me ask you, what do you think is going to happen when you say, do you ever think about anybody but yourself? What's going to happen? Yeah, for all we know, she's going to go right back out the door, back into the rain, back on the road. So how effective were you? If your goal was to help her be more responsible, if your goal was to help her make better choices, how effective were you? No. And that's the point I want to make. This is not about, are you justified in being angry? Of course you're justified in being angry. But we're talking about someone who is born with emotional intensity. If you're going to communicate effectively, we have to get the intensity down. When you come out with what we call a secondary emotion, the anger, the primary emotion was fear, secondary emotion is anger. And when you come at someone with that, the emotional intensity of the room and the interaction goes way up. The person with BPD can't manage that. So you've got either a withdrawal or a fight on your hands. So accurate expression would say, when she comes in the door, and I can teach you to do this, honest I can. It takes a lot of skills, but there's skills for this. What I want you to say is, I am so glad you're home, sweetheart. I am so glad you're safe. I was scared, so scared. Let's get you to bed and we'll talk some more in the morning about how we can help this not happen again. I know that doesn't feel right or just. But what do you think's more likely to happen if you respond that way? She's more likely to go upstairs and go to bed, and that you could have a conversation in the morning when the emotions are down. And the brain is back on board. That's accurate expression. What I'm asking you to do is to be aware, be mindful of your primary emotions and express those rather than going with secondary ones. Okay, so spouse, you come home from work, you've had a really bad day at work, you walk in the door, and your spouse is cooking dinner, and you look at him and you say, "Oh, couldn't we have something besides meatloaf?" What kind of response are you going to get? Okay, we won't talk about that. All right. Are you expressing yourself accurately? Is that accurate expression? No. What's accurate expression? Yeah, I say, hey, I'm really cranky. I had a hard day. I'm really cranky. I'm just going to go be by myself for a little bit, see if I can, drink a cup of coffee or something. Or even, hey, I need some attention. But what does that do? Why don't we do that? It's because it creates vulnerability. It's really hard to say what we're really feeling. Really hard. But yet it's on a smaller level, it's the same thing that individuals with BPD are doing. They're looking at it and saying, I hate you. That's inaccurate expression. What they're saying is, I desperately want you to love me, and I'm afraid you're judging me, and I'm afraid I've totally disappointed you again. Or I really, 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 really wanted this, and you won't let me have it, and I don't know how to handle that disappointment. We're doing the same thing, just on a different level. And we can still live effectively, and people with BPD cannot. It starts to destroy their lives. But I'm using that to try to help you understand a little bit better. So if we invalidate, so they come in and say, I hate you, and you don't hear what's behind it, and you say, then just get out. You know, you sure don't hate me when you want to borrow the car. We don't have communication at all. It's really hard to do, but if you can validate, and validate means, what validate means, by the way, is to look for the truth and only at the truth and acknowledge what's true and real. Validate doesn't mean agree. Validate doesn't mean to just nod your head and say everything's okay. Validate means to listen for the truth and acknowledge the truth of what someone else says. And to acknowledge the truth and the legitimacy of someone else's internal experience. So if someone says, I hate you, validation is to acknowledge the legitimacy of their internal experience would be, wow, I have really upset you. Yeah, right now I don't really understand exactly what I did. I know that may upset you more. I really want to understand what I did. But I have really upset you. When we can do accurate expression and validating responses, then that's healthy and effective communication. That's where I want to get us. And if you have someone in your life who has borderline personality disorder, that's what we want to teach you. How to do validating responses effectively and how to do accurate expression of your emotions. Okay, so I found some cartoons that talk about accurate expression, and I thought they were really something that maybe everybody could identify with. So accurate expression, it says, don't say, you can read it, it says, don't say, sorry I'm always late, when what you really mean is, hey, thanks for being patient. You know? And one of the things we teach in DBT is that we can over-apologize, and that when you over-apologize, people stop listening to the apology. And that when you over-apologize, like have you ever seen, okay, I have done this, all right? Have you ever walked into a room, bumped into an empty chair and said, oh, excuse me? I've done that. And for some reason, we've gotten to the point, well, okay, that may be an overstatement. I'll back up. Sometimes we apologize for our very existence. And we apologize for whatever we do. That's not accurate expression. We're not expressing ourselves clearly or communicating clearly. And the reason, the core of why this is so important, is that accurate communication leads to trust. Accurate communication leads to trust, leads to connection. And you heard Jaime say, and it's true for most people with borderline personality disorder, I don't know how I fit in. I don't know where I fit. I don't know how to connect. I don't know how to have a relationship. And so my relationships are all chaotic. Accurate expression leads to trust, leads to connection. So for someone who has borderline personality disorder, part of the reason they need validation from you is that they don't know sometimes what accurate expression is. Okay, so I'm going to give you a very broad example. You know when you have a child, and your child is learning to talk, and you go down the road and you see a dog, and you point and you say, dog. And your child says, dog. And you say, that's right, dog. And then, a few months later, you're going down the road and you see let's say a collie. And the child says, dog. And you smile and say, yes, collie. And the child says, collie. That's how the child learns the words that we put on the world. Well, those words are also words of emotion. And the way your child learns about emotions is part of what you reflect back to them. My grandmother, she used to say to me, Karyn, now don't be ugly. And I didn't know for the longest time that refusing a gift or refusing food was what she was calling ugly. I was like, don't be ugly. Okay, I thought it was mean or something like that. And sometimes, if we don't know the right word, or we're guessing, then we can teach children, they can get confused. And it's easy enough to get confused about emotions. Excitement can be easily confused with happiness, and they're two different things. So you are teaching the child how to label emotions, and actually that's part of emotion regulation, just being able to label what you're feeling. But if in your family, for some reason, you weren't taught to talk about emotions, or emotions just weren't something that you did talk about, culturally, there are some cultures that don't really talk about emotions, and then the children get, you're overreacting, you're too sensitive, you're dramatic because it looks that way, then they don't learn what the emotions are or how to deal with them. They're not learning the skills that I just talked about that you guys know naturally. So validation is the way we start to teach someone with borderline personality disorder. We validate the truth, and so that we start to teach them, yeah, that's right, I see. And they start to trust their internal experience, and then they start to be able to build a sense of who they are. Okay, so more of these, like, sorry, I'm not making a lot of sense. And then versus, thank you for understanding me. Sorry, I'm kind of a drag. Thank you for spending time with me. Sorry, I'm just rambling. What you really want to say is thank you for listening. Sorry, I take up so much space. Thank you for appreciating me is what you really want to say. Sorry, I'm such a disappointment. Maybe what you really want to say is, thank you for having hope in me all this time. Don't say sorry when what you really want to say is thank you. So my challenge for you is to start thinking about what you're saying. And are you expressing what's really in your heart? Are you expressing what really your primary emotions? And is it being effective? Because if it's not being effective, then we need to find a different way too. So it is time for questions, I think. Yes. So let me just stop here. And Jaime, are you willing to answer questions? Okay, so I want to join Jaime in thanking you for being here. For me, helping people be able to recognize borderline personality disorder is one of my values, I guess. I'm passionate about that because so many people are going through so much pain and they don't know what it is. And being able to say this is what it is and we know how to treat it and you can recover means a great deal, and it can make a huge difference. And there is so much hope for BPD, actually, so much hope. But we as a mental health profession, we've not done such a good job sometimes. And so a lot of people who have sought out help that hasn't been effective have really sort of given up on us, and understandably so. Up until recently, we really didn't have effective therapies that really could treat BPD, but we do now. And so getting out the word, I'm very grateful to you, and I'm grateful to you for helping us do that. And sometimes you may need to go to your therapist and say, this is what I know. What do you think? Because there's so much information for mental health professionals to learn, and you as a parent have a view that they don't have. And your information can be really critical. It's also the case, I said I was going to stop, it's also the case that your involvement, research shows, your involvement makes recovery more likely and a higher level of recovery. So I just want to put a plug in for something called Family Connections, which is a free program. It's research-based. It's developed by Dr. Alan Frizzetti and Dr. Perry Hoffman. It's all over Houston, and there are teleconferences that you can join, and it teaches skills, accurate expression and validation. Those are some of the skills it teaches, and you can learn those skills, and that can help you make a contribution, whether or not your loved one is willing to go to treatment. The research also shows that if you change, and if you change the way you regulate your emotions, and you change the way you interact, it benefits the person with BPD, with borderline personality disorder.